Hello there, I'm Dr. Powell. In this video, I'm going to discuss the integration of retained frontal tufts into the design and planning of a hair transplant. And I'm going to illustrate this using a 6-month follow-up of the top case of a guy who has a very prominent frontal tuft. Now, these frontal tufts that I'm referring to are also known as frontal forelocks, and they're these oval to round area shapes of hair that are located in the frontal central portions of the scalp. The sizes can range anywhere from a few centimeters to much larger, almost extending to the lateral fringes, which are the remaining hairs at the sides of the head for those guys with more advanced hair loss. The frontal tuft is important because it can contribute a significant portion to the framing of the face. And obviously, larger frontal tufts can help provide better framing. A persistent frontal tuft is a natural occurrence for some men with male pattern hair loss. And these tufts are cosmetically important because if there's good density in this region, it helps to give the illusion of having good density in other areas of the scalp from a frontal view. However, in profile, hair loss in other areas would be more obvious. Most social interactions occur face to face, so if there is good density in the frontal tuft region, it'll help to maintain a frame to the face as well as contribute to the appearance of fullness. And because retained frontal forelock is a natural occurrence in male pattern hair loss, a frontal forelock approach has been a procedure of last resort that has been offered since the 1990s for those guys who have very advanced stages of hair loss, but who also have the misfortune of having very poor donor densities and not having sufficient number of donor grafts in order to do a transplant to the full frontal half of the scalp. So what this procedure did was allow these guys with advanced stages of hair loss and limited donor allow them to reframe their faces by creating a frontal forelock, which used much smaller numbers of donor grafts than would be needed to do a transplant of the full frontal half of the scalp. So let's take a look at some images. If a forelock persists to the man's mid-30s, it is likely to remain despite continued hair loss in other areas of the scalp. Additionally, if there is a strong forelock with a family history of this forelock sticking around despite hair loss in other areas, there is an even greater likelihood that he would retain this forelock as well. Since this guy was already in his late 30s and has a family history of similar persistent forelock, we felt confident that he has a very good chance of keeping it. Nevertheless, we do need to keep it in mind for the future should he lose the forelock despite his history. So in planning his transplant, we used the retained tuft to his advantage by incorporating it into his transplant design. And because this tuft was still solid at the time of surgery, I carefully worked around it, integrating it into his hair transplant design, and used the donor grafts to fill in the areas around it. Because it is still so strong, not only would it have been a waste to transplant grafts into it, there would have been a higher potential of damaging good, healthy, strong hairs in that area. However, if it did show signs of miniaturization or was thinning, I would have carefully worked through the area in order to avoid leaving a hole as the hair loss in that area continued to progress over time. And this is him 6 months after the procedure, and you can already see the dramatic transformation. His face is very nicely reframed, and he now looks like he has a full head of hair from every angle. And despite the high hair color to skin color contrast, you can see that he has very good coverage with this single pass and at this very early maturation stage of only 6 months. Here are some side-by-side before and after comparisons so you can really see the difference. Again, we were able to use the frontal tuft to his advantage and to use his donor hairs to recreate the rest of his hairline and to fill in the balding areas further back in the scalp than we would have been able to if he did not have that retained forelock. If he should ever begin to thin in the tuft region, which is not likely given his age and family history, he would need to have a small procedure in the future to fill that region in. As always, thanks for watching. I hope you enjoyed the video, and please stay tuned for more videos in the future.